Let's talk labrum. So labrum is the fibrous cartilage that lines the inside of the acetabulum. And we also have articular cartilage, which is the cartilage that's the end of the bones. The fibrous cartilage in the labrum is much thicker and withstands a lot more resistance and will help also serve as a suction cup. So it gets thicker as you line this outside rim of the acetabulum, which helps create that suction and keeps the femoral acetabulum or femoral head inside the acetabulum. So this labrum can get torn for a couple of reasons. Overuse, like a chronic tear, would be overuse over time of just rubbing all the compressive forces going through the hip. Also, we can have this happen acutely from like one big injury, and usually it would have to be like a big fall, like a lot of landing, a lot of hard landing. The head is always in here, but it would be more like a force like that. So gymnastics landing from a vault, figure skating, landing, constantly, that kind of thing. And then also we have, you can have tears to the outer rim from extreme ranges of motion. So like dancers and figure skaters are, bringing their heads like over their head on these extreme kind of ranges like that. Also, ice hockey players are in this constant kind of going like abduction, adduction, flexion, extension, like combined movement because their foot is on unstable ice. So it's this kind of like gliding where we're going out when we're skating, and it's constantly putting compression on that outer rim. And so also ice hockey is predominantly men, and men are more likely to have labrum tears and because they have what's called femoral acetabular impingement. And so femoral acetabular impingement can be found in women and men. It's very common to be found, but it's the misshape of the femoral head and or the acetabulum, and it's more common in men. So then that's also why they think we see this more in ice hockey as well. There's a lot of studies that have been done that say that a lot of people in general, men and women, but more men than women, have labrum tears. They're just asymptomatic, which means they don't have symptoms. As long as you have the appropriate biomechanics and you're not doing things that really put stress on that area, then you usually don't see symptoms. But people in high level sports that are doing lots of repetitions, competing at high levels where the compressive forces through the hip is much higher, then you're usually going to see those labrum tears. So for femoral acetabular impingement, you can have a labrum tear without this. But having femoral acetabular impingement puts you at a more higher risk of having a labrum tear because there's now more pinching going to happen. So it's where there's more bone on the outside of the acetabulum, causing it to hang down lower than it should. So this femoral head then doesn't have the range of motion that it does with a normal acetabulum. And then that labrum that's kind of lining the outside is going to get constantly pinched. And then the femoral head, instead of it being a circle, it's going to look more like an oval. So instead of having this nice round curvature here, it's just going to kind of lump down. And then that also causes it to get pinched. So when they look at x-rays, the first thing they do when they suspect a labrum tear, because someone's presenting, basically they're not going to present with pain out here. They're going to present pain in their groin. It's going to be going down into their groin. And they're also going to be having typically, they'll wake them up at night with like a throbby, achy kind of pain. That's also a sign of a labrum tear. So oftentimes they will see them and figure out what's going on and do an x-ray to see if they have femoral acetabular impingement, just to see basically what's causing it, and then they do the MRI to find it. If they do have femoral acetabular impingement, they may need to go in and shave down that bone, which is a more complicated procedure. If they don't have it and they just have a labrum tear, they're going to decide between surgery or not surgery. The problem is that there's a lot of studies to prove that you don't need surgery for this. You can do an injection to just have anti-inflammatory and then do rehab to strengthen the muscles around it, and it decreases the amount of forces through it. So it usually helps people not have pain. If you're playing a high-level sport and have lots of ranges of motion that are really squeezing that labrum, or you have lots of compressive forces, like lots of running and jumping that's going to keep happening, then you're just going to go in and do surgery. And it's a pretty extensive procedure and recovery, so that people don't go into that lightly. If you have any questions about the labrum tear, this is the only real injury that we worry about being intra-articular within the joint. Most of the other things are going to be thigh type, muscular type of issues. Any questions on this, please reach out.